about that.
Can I ask, a couple people have asked, when should you get tested? When is the test? So let's say you've had an exposure, possible exposure because you went to a protest yesterday. When will a test be accurate?
Yeah, I mean, I think here in Wisconsin, they're saying if you need a test, get a test. If you think you've been exposed, get a test. But I do think that you have to be aware that early on you could get a false negative, right? And so I actually don't, does anyone know the sort of sweet spot window for testing?
My understanding is about 3 to 5 days probably after initial exposure, you'd have enough replicating virus to detect. So,
you know, and it could be before you have symptoms.
Yeah, absolutely.
That's consistent with my understanding too. And so what you get is after you've been exposed, the virus starts replicating in your respiratory system. But there's not enough of it to actually pick up the virus to test positive on that swab that they stick up your nose until it's had a chance to replicate for a few days. And so it's not really a false negative. It's just that there's not enough virus yet to detect. So you want to wait. And my understanding is also 3 to 5 days should be good for in most instances, but also monitor symptoms because that's not a perfect metric.
Yeah, but keep in mind that you may be someone who doesn't have symptoms, asymptomatic person, or you could be in that pre-symptomatic phase and still test positive. And it's really in that window of time where people are transmitting to others. And so being proactive about, you know, seeking out a test is a good idea, I think.
Yeah, and in the meantime, masking around, especially vulnerable family members and keeping a safe distance, all of that is a good idea.